We're excited that you've chosen Perry County Memorial Hospital for the birth of your baby. The anesthesia team here is available to you 24 hours a day, 7 days a week. It's staffed by highly trained, certified registered nurse anesthetists, also called CRNAs, who are here to make your experience safe and more enjoyable.
Okay, a lot of people ask the question, when can I get an epidural? And typically, we would like you to be in active labor. That means your contractions are frequent and they're getting stronger. And secondly, we would like your cervix dilated to about 4 or 5 centimeters, which means about 40 or 50% of the way dilated.
Sometimes people ask if placement of epidural or CSE hurts. The injection of the numbing medicine that's placed initially before we actually do the epidural does cause some discomfort. After that, you should feel just pressure, generally not too much pain after that point. Occasionally when we're injecting the spinal, you may feel a little sharp shooting pain or tingling down in a leg or a thigh. That's temporary and usually goes away pretty quickly and is not a problem.
Epidurals have very little effect on your baby. Unlike IV narcotics, the amount of medication that gets transferred to your baby is minimal, so it's a very safe option for women in labor.
Epidurals will facilitate your delivery. And studies have shown that sometimes when you get an epidural, your delivery will go much faster because you're more relaxed. Now, sometimes at the very end of your epidural, we have to decrease the dosage. We want you to be able to push when it's time to push to get that baby out. And what we'll do is sometimes decrease the amount of dosage that you get. And sometimes when we do this, you're able to push better.
Continuous dose of medication is administered through a catheter in your back, so you may have to remain in bed and have frequent blood pressure checks. Sometimes a catheter is also needed to be placed in your bladder, as urination may become difficult after the epidural is placed. After the epidural catheter is pulled, it usually takes about 2 to 3 hours for all the effects of the medication to wear off and you to return to a normal state.
Sometimes we're asked, what are some of the reasons why a person can't have an epidural or spinal or CSE? And some of the answers to that would be if the patient had a low platelet count, which would put them at higher risk for bleeding. If they're currently using or on blood thinners, if you have an infection that's in the region or the location where we'll be placing the epidural, that would be a contraindication. Or if you have a blood infection. If you are not 4 centimeters dilated in active labor, we like to see patients that are in active labor prior to initiating an epidural. Or if the patient comes in and is having bleeding problems and there's an emergent situation where they have to go to the operating room and there's no time for an epidural. Or if the labor is moving too fast. Some women come in and are already 10 centimeters and ready to deliver a baby, and therefore there's no time for an epidural.
Our philosophy here is that if you're more prepared for your labor and delivery experience, the more enjoyable the overall process will be. And we're really here to help you have the best experience possible.